topic. When Bob first asked me to come, I thought, what am I going to talk about? So, pleased to be here. I've got a presentation here, but I'll try and keep it fairly informal. If you have questions for me, I will try and watch the clock as well. Because I have till 9:15, right? Okay. So, what keeps the Lynn awake at night? Insomnia. So, there's a lot of things that the Lynn is responsible for. We have, I think as everyone knows, we have 149 different organizations that we fund, over 200 service accountability agreements across this large geography that we're responsible for, stretching from Long Point up to Tobermory. So there's lots on the go, all the different sectors, 19 hospitals on 32 different sites, 75 long-term care homes, the CCAC, community support service agencies, community mental health and addictions agencies, so lots of organizations that we're responsible for. So I've got two slides here of what causes insomnia, and it's really a mix of different things across our scope of responsibilities. So I'll just go through the list, and you'll see as I go along, and Ron mentioned it earlier, is that my wife always complains that she has a problem, she wants to talk to me about it, and I'm right there with the solution. And she says, can't you just listen? It's not my style. If there's a problem, I like to show a solution. So you'll see that here's some issues that are keeping us awake at night, but I've also indicated or provided some different solutions that we're working on to try and address them. So things that are causing us insomnia, ensuring that the residents of the Southwest Lynn have access to quality care when they need it from the right provider in the right place. A great example of that here in Perth is child and adolescent mental health beds. It's been an ongoing issue for many, many years. It continues to be a challenge. That's just one example, I think, in this particular area, but there's lots of other examples across the Lynn where we want to make sure that the people that need the care are getting it in the right place and getting it from the right provider. Cancer surgery wait times. Our cancer surgery wait times in the Southwest Lynn are the worst in the province by a long stretch. If you look at the wait times indicators across the 14 Lynns, ours really stands out in terms of our cancer surgery wait times. So I'll talk a bit about that as well. Ensuring seniors have high-quality community-based programs to remain healthy and stay longer in their own homes and communities. This is a whole mix of different issues within that. ALC, alternate level of care patients, making sure that we have proper supports in the community, and I'll talk about aging at home, some of the programs that we have there. The inability to easily transfer data and information across organizations and between sectors. You hear the story all the time. If Walmart can keep track of their inventory across the entire globe, why can't we do something similar in healthcare? We've got a long ways to go with our health information, whether it's a medical record in a physician's office, whether it's a patient record in a hospital, whether it's a client record in a community support service agency. They all need to be connected, and I'll talk a bit about that in terms of the progress we're making, but we've got a long ways to go. Emergency department pressures. It's no surprise to anyone here in Seaforth that you've experienced here in Seaforth with the emergency department being closed in the evening because of a shortage of nurses. I know there's going to be a lot of discussion today about the health human resource issues. In Seaforth, it was nurses. Other communities, it's physicians. This is a challenge that's ongoing, and especially in the summer months. Practically every week in the summer, I'm getting calls from the minister's office or from the ministry saying, we've got 2 shifts open at St. Mary's, or we have 2 shifts open in Southampton, or 2 shifts open in Owen Sound. What can you do to help us? And the Lynn doesn't create doctors in our back room. It's a system issue that we need to address. So I've got some solutions or opportunities that we can look at there. Diabetes. I think probably everyone in the room knows that diabetes is on the increase. It's increased by 69% in the last 10 years. I expect it to grow to 1.2 million people in the province that will have that by 2010. Another item that keeps us awake at night is how do we know that we're delivering quality care? I think we all hear anecdotally of the good things that all the organizations are doing, but how do we know as a system that we're actually providing the quality care that we need to provide? And I'll talk a bit about the new Excellent Care for All Act, which is helping us to get to a point where we'll be able to do that. How do we enhance that patient, client, resident experience? This is a message that I give consistently of what the Lynn does. All the organizations that we fund do a great job of what they do within their own organizations. But the Lynn has that responsibility for that transition point between sectors. So when the patient's being discharged to home or being discharged to community, what about that transition point? I think that's where we can find the success and improvements in that patient and client and resident experience or satisfaction piece. ALCs, this is an ongoing issue for the government of Ontario. They put considerable pressure on us as a LIN organization to ensure that we're addressing ALCs. For those of you who don't know ALCs are those patients that are in hospital that no longer require acute care and are actually looking for an alternate destination, whether it's in a long-term care home, whether it's within their own home with community supports. Getting those patients out of hospital, getting them into the right setting. And then finally, ensuring that the financial resources are used effectively as possible. There's no question that in the province of Ontario there is a financial issue that has been for the last 2 years. The amount of debt is increasing considerably. I have a presentation that I provide that shows the amount of money that's spent across the government on healthcare and on education and pieces like that. There's a piece of that pie chart that shows debt repayment, and that debt repayment is increasing astronomically in terms of the amount of money that government expenditures are going towards. So we need to look at how we're spending those resources to ensure that we're doing things that we can sustain the healthcare system that we have now. And obviously at the bottom is making sure that we address things for the next generations. So those are the things that a wide mix of issues that keep the LIN awake at night. Here's some of the strategies that we're implementing. And you heard Ron talk today, our blueprint, and hopefully you've heard about the blueprint, at least in a small piece, if not, as Ron said, it's on our website. The blueprint is that plan for what the system should look like going into the future. It's a mid-level plan, so it doesn't get into saying organization X is going to do this and organization Y is going to do this, but it talks about how we're going to work in a unified system of care. And the unified system of care is where all the organizations are working together, ensuring that we've got hospitals working with long-term care working with community supports, CCAC working with hospitals. Wherever those connections are being made, that it's one system of care, not divided up into sectors. That blueprint also provides a foundation for our board to make funding decisions, because we have $1.9 billion that we're responsible for in allocating to all the different organizations. At the start of our mandate, we didn't have a plan. So if we're saying we're going to invest in this particular initiative, the board didn't have the justification to say, well, we're doing it because of this. Now that blueprint provides it for us, so I think it's getting us into moving us in the right direction so that we can make appropriate decisions, our board can make appropriate decisions. And our two strategic directions, one dealing with the population-based integrated health services, and the other centrally coordinated resource capacity. That's where the bottom one is getting the hospitals working together more cohesive fashion. So there's lots of provincial strategies in support of our LIN initiative, the Excellent Care for All Act. Right now, the Excellent Care for All Act is only applicable to hospitals. They have to submit a quality plan this spring, I guess it is, for consideration. But quality should be a piece that's intermixed with all the work that we do across all of our organizations, whether it's any of the sectors that we fund. And I see the County of Huron is here as well. Municipalities have the same requirement for ensuring that we're providing quality